Hey guys, so I decided to answer the question, what would you say if a patient or client with a diagnosed fatty acid oxidation disorder wanted to start exercising regularly? So, of course, let's start with the background. Fatty acid oxidation, otherwise known as beta oxidation, is the catabolic process by which fatty acid molecules are broken down in the mitochondria to generate acetyl-CoA, which then enters the citric acid cycle, of which we learned about earlier in the semester. Fatty acid oxidation disorders are disorders due to the disruption of either mitochondrial beta oxidation or the fatty acid transport using the carnitine transport pathway that David talked about in his presentation. There are 12 fatty acid oxidation disorders that are specific, depending on the enzyme that is deficient. Partial or complete deficiency of the 4 enzymes in beta oxidation can lead to accumulation of fatty acids and metabolites. This leads to an energy deficiency related to depletion of TCA cycle intermediates. Treatment for most, if not all, includes avoiding fasting, restricting the intake of long-chain fatty acids, and increasing intake of MCTs. There are several symptoms of fatty acid oxidation disorders, including liver dysfunction and hypoketotic hypoglycemia. But I am going to touch on rhabdomyolysis due to its high relation to this question. So, rhabdomyolysis is a breakdown of muscle tissue that releases myoglobin into the blood. The protein myoglobin can cause the kidneys, which can damage the kidneys, which can lead to kidney damage. I wanted to talk about this symptom in particular because I would bring this up and explain what rhabdomyolysis is to a patient if they came to me wanting to start exercising regularly. Exercise uses a lot of energy and increases energy expenditure, which means it's using a lot of acetyl-CoA, and someone with FAOD may not be able to replenish their energy. This can also lead to increased chance of hypoglycemic episodes. Fat is needed as an energy source during periods of decreased intake, which in this example would be exercise. Someone may experience rhabdomyolysis, I totally messed that pronunciation up, more severely, leading to kidney damage if they are exercising regularly and taking necessary precautions. So since the body is rapidly using glucose during energy expenditure, I would tell the patient that increasing carbohydrate intake before exercising will help the body from having a hypoglycemic episode, and also bringing a snack of some sort that contain mainly carbohydrates to have during the workout, as well as having a high carbohydrate meal snack post-exercise. Thank you so much for watching. Again, sorry for my mispronunciation of a couple things.